Beginning, first of all, I think before I do that, it's welcome all. Good evening from Australia. I don't know, good morning good afternoon in Nepal. So good to be here with you on a very important special session. This session is of 2 hours. We'll run 4:30 to 6:30. There's a bit of a flexibility. We can extend 5-10 minutes if required be, but otherwise we'll try to finish in time. And the format of the seminar is that we will have in the beginning the very formal acknowledgement, the thank you and welcome note from Sabina, and then we will have a formal acknowledgement of the country from Australia as part of our obligations that we do in conducting or running any workshop or seminar or any events we run through. So after that, I will then introduce, invite give you a little bit background on the importance and the significance of today's event. What does really it mean to Smart Health Global and why we are holding this seminar today and the context of it, a little bit background. And then I will invite the panelists to briefly introduce themselves. And I think you are given about 7 minutes or so to share your experiences in regard to the theme science and innovations and smart health. What does it really mean in your experiences and expertise and involvement and what smart health can do? That will come follow up in the question hour, but you will share your experiences in the 7 minutes. And after that, we will then run interaction between the panels among the panel members for another 30 minutes. And then after that, we all come to a point where there's some clarity of what we have discussed and come to a point, then we will open the floor to the audience on the chat box or live online, and we'll take the questions. They won't be directly raising the hands or asking you the questions. We will take up the questions and we'll then articulate those questions to the panel member specifically required, or otherwise, if it's to all panel member, we'll ask them to respond to that, and that will run another 30 minutes or so. And then after that, we will summarize the session, whatever the key messages come out from the session. And importantly, these messages will then be forwarded to Smart Health Global for further follow-up. So this basically is a very informal and a very interactive technical meeting session. So and then we'll follow the online Zoom protocol. We'll keep all the speakers on mute, or you can mute yourself, and no background noise, no distractions like that, and we'll try to take questions from the chat box. So this is kind of a and anyone who wants to raise questions, also they have to raise their hands and introduce themselves when allowed to do that. So this is basically a rundown format. If you have any concern or any suggestion, please let us know at this stage.
Thank you, sir. In terms of the flow, do you want to go one after
another?
We'll
come first. Yeah, we'll come first. Yeah, that's a very good question. I think we will go with because it's Smart Health Global run by the Nepalese and the in the context. So we'll invite Kaloni first to give the backgrounds in the Nepalese context, and then followed by, I think we'll go by Tahim from the Latrobe University, and Dr. Yakindra Timil Sinha, and also our Biswasji at the end.
Raj sir, I think Biswasji will be the better first one, I think, to start with, because okay, he will give a brief overview of Smart Health Global. And
yeah, that's a good idea. I think smart. Yeah.
Then maybe Dr. Kaloni.
Okay.
Then Dr. Tahim, and then myself.
Then yeah, Dr. Yakindra. Are you all happy with this line of order?
Yeah, that's excellent. And then you go in the rounds, right? First round, second round.
Yeah, that's true. And then once you have spoken for about 7 or 10 minutes, I think 7 minutes exactly, but then we will open the floor amongst the panel members. Then we will be asking the questions to the panel member from the Smart Health Global Forum. We have shared some questions with you prior, and you have seen those questions. There are 5 questions set up, but not necessarily we'll ask all the 5 questions. Given the time of 30 minutes, I will try to put questions in the context after your presentation, after hearing your thought. I'll try to modify the questions and put those panel member, and then we will discuss and try to, answer those questions from the panel member. And then only we will go to the floor to audience to ask the questions.
Awesome. Thank you.
Yeah.
Awesome. Okay, thank you so much. With that note, I would now, I think, invite Sabina. She is a project officer working at Smart Health Global, and she is stationed in Nepal. So she will be the one welcoming you and then inviting me to take over. Over to you, Selina ji, and then we
Good
can go live
afternoon.
from here.
Okay. Good afternoon, everyone. Firstly, I would like to welcome all of you on behalf of Smart Health Global in this today's webinar session titled Empowering Health Through Science and Technology. On behalf of Smart Health Global, I would like to firstly welcome you all, and now I will also be assisting Dr. Raju Adhikari sir in this today's webinar session. So, okay, now I would like to hand over this session to Dr. Raju Adhikari, who will be doing the moderator of this today's webinar session. Thank you.
Thank you, Sabina ji, for your welcome note and also welcoming all our panel members. It's a great honor for me. I am the research director at Smart Health Global, and I work in Australia at CSIRO. It's a great honor and privilege for me holding this session on a very important National Science Week day. In Australia, we celebrate in July, the month of July and August. And also we would acknowledge the country's first, before I go on to the next step. So first of all, I'd like to acknowledge the traditional owner of this land, and pay my respect to the past, present, and emerging leader of the Urunrai people of the Kulin nations who have allowed us to come to this country and connect to the land, water, and sea. So with that note, I think I would like to now give a little bit background in the context of what National Science Week is, so that the panel member will then go on to their briefings. So National Science Week is not an international day, it is a national day. Each country celebrates National Science Week. In some country, few days, in country weeks. In Australia, we celebrate for a week. And in Australia, it is celebrated in the month of July with, I was looking at the literature that it's been going on for a while, and there are more than 1,000 activities we conduct during this week. And all the universities, the scientific institutions, industries, schools, they equally participate through different activities. And the main purpose of this Science Week celebration is to recognize the contributions of our scientists who over the years have worked to make this world a safer place, a better place, and look after us through their innovation and technological breakthrough. So this is kind of a tribute for them to be remembering for their innovation, and also a week to remember and review how science is interconnected in our daily life, especially in this DNA and knowledge age, and how we need to connect science to the people in a way so they are better connected. And also at the same time, we're looking beyond today into the future, what science can offer, what are the issues with the science, the challenges, the opportunities in the innovation, and how science will shape our future. So these kind of three things we look at into this during this week. So it's kind of a celebration. And National Science Week in Nepal is celebrated in September. In India, I think it's celebrated in February in the remembrance of Raman, Dr. Raman, who received Nobel Prize 1960 for his Raman effect. So different countries have different way of celebrating, but ultimately the ultimate objective is to share the glory of science, looking into the future for making this planet a better and a sustainable one. So with that note, I think I would like to Especially, I also like to add to the knowledge of the panel members. As I was reading through the Science Week, a few key messages. Lately, in the last decade, there were some significant milestone breakthrough innovation that has completely changed science into a new direction. If you recall, there was a DNA genome mapping. That was the first discovery which really shaped and changed the direction of the science. Then we came into, after this, the DNA genome. I think we also then were driven by COVID messenger RNA technology, where for the first time the messenger RNA is being taken in the front line to make new and smart drugs from cancer to any neurological diseases or anything we facing now today. So the DNA genome mapping, messenger RNA, and now I think especially also DNA telemer that discovery by European scientists to see how our DNA is degenerated over the time due to toxicity and other side effects in our body. And if you want to live longer, you really have to protect the DNA, and that plays a very vital role. So all of these people who discovered these things, they received Nobel Prize. So in the last decades or so, the science has really moved into DNA. So the innovation is making really a breakthrough. Now coming into this world today is AI, artificial intelligence, which is also adding a new dimension to all this discovery, making discovery move faster, and more, early intervention diagnostics, all coming in a very powerful way. So as we're talking today to discuss this science, technology, innovation interface, we're looking at from two different angles. So one, developed countries where the science and technology is very advanced and the system is in place, and the people can afford and access any innovation that comes into their life with the government support, with the knowledge they already have. Whereas if you look at in developing countries, it is completely a different scenario. The technology which comes or the drugs which comes and being used in developed country takes ages to come to developing countries and to really being used by other developing nations. So there's a huge gap even after the discovery is made or this thing. So with this, the technology may be helping this bridge the gap, taking this innovation very quickly to developing countries and making better use of and faster application and acceptance. So these are the things I think in the National Science Week we will be looking at, and our panel member will be sharing their experiences, what really smart health means in the global perspective and in context to developing countries. With that note, I would like to now invite the Chief Project Officer, Biswas Bhatta, who has been working with Smart Health. He's one of the founder and has been working with the Smart Health for over the years, and he has got real insight, story to share with us. What does really Smart Health means in the context of Nepal? Please, Biswasji, it's a floor to you now for the next 7 to 10 minutes.
Thank you, Dr. Raju. Please let me know if I'm audible or not.
Yeah, you are audible.
Okay, thank you. So first of all, I would like to begin with thanking the Smart Health Global Australia team for this privilege, for giving me a platform to talk on the occasion of National Science Week of Australia. So on the long list of works that our Australia team has been doing over the years, this also should be counted as one of the major achievements, and I'm really privileged to be a part of it. Starting with my introduction, I'm Biswas Bhatta. My academic background is in computer engineering. I did my bachelor's in computer engineering from Kathmandu University a long time back. And then I hold a double master's degree on public sector innovation and digital governance, where my research specialization was on digital health. And one of those master's degree was a joint MSc degree under the Erasmus Mundus scholarship provided by the European Union. I've been working for almost 15 years now, and among those 15 years, 10 years, I've worked in digital health sector, both on the public and the private side of things. And um, my journey with the public health side of things started with an organization known as Medic Mobile. Now they're just called Medic. I used to head their technical operations for Asia region, and been fortunate to pilot and scale a lot of projects there, expanding across various domains. And currently, I'm working as the Chief Technological Officer for Smart Health Clover, where we are developing and deploying various digital tools that aims to increase the level of health services provided to these communities in really remote areas of Nepal. So talking about digital health, like how Raj sir gave a brief introduction and also brief summary about how science has advanced through all of these years. And by extension, technology, especially digital health technology, has also expanded almost in an exponential rate at the same period. So digital technology, as we all know, have advanced several fields. You can talk about education, you can talk about transportation, you can talk about social, you can talk about governance. We can see how digital technologies has helped advance all these fields, leaps and bounds. And it's no surprise that it has also impacted the health sector as well. So talking about digital health, we can see it being applied in a lot of phases. It's not just about improving the accuracy and efficiency of diagnosis. It's also about making the delivery of healthcare much, much more accessible, much more less expensive, and also much more faster than it used to be. And Dr. Raju, in his introduction, touched upon a really good point where he mentioned that even though the world is advancing in such a fast pace in terms of science and technology, it still takes a lot of time for those advancements to come into least developed countries like Nepal and similar countries all over the world. And we can see that happening with our own eyes here in Nepal. So that comes to Smart Health Global and why we are here. So Smart Health Global is a collection of technologists, public health professionals, and pharmacists and lab technicians and other health-related professionals who are living all around the world and who came together as under this umbrella with one aim, and that is to provide better healthcare services to remote communities using all the digital innovation while making sure that all the digital health services that we provide are equitable and sustainable. So with this mission in mind, we started almost 3 years back. We went to communities, we talked with different professionals, we went to health facilities in all these remote areas and talked with the professionals, try to find what their problems were and how we can start solving them. And one of the main problems that we found was the lack of properly trained doctors to give services to patients in these areas. So there's this big problem in Nepal, which have been verified by various researches and articles that clearly shows that there's a lack of doctors who are willing to serve in these remote communities. And it's not just about accessibility, but also about like their own career choices, their own personal choices, their livelihoods and stuff like that, which makes it really hard for doctors to go and live in this remote area and provide their services. But if we see on the urban areas like Kathmandu and then say Pokhara, Biratnagar, all these developed city, we see that there's a surplus of doctors and like they are looking for jobs, they're trying to go abroad to find better opportunities. So we thought, okay, maybe we can use this imbalance to our advantages. So we started by developing a telehealth tool using which we can provide telehealth services to all these people in the remote areas through doctors living in Nepal and also abroad. So that's how we got started. We piloted 2 years back, and within these 2 years, we've been able to expand our services to 18 different municipalities I think we've already included 54 different health facilities within these municipalities, and we have around 7,200 patients that are registered in our system. And within those patients, we've been able to successfully provide teleconsultations help, including specialist help to more than 2,000 patients during this time. And through this, we've seen how technology can be used to help people even though there are no immediate services provided to them. We provided telehealth services even during midnight hours, utilizing our doctors' rosters who are currently residing in countries like USA or Canada. We have also providing consultation as well as referral service, and then coordination with the referred health center to provide further care for the patients who were referred there. And through all these experiences, we are very sure that we can use the digital innovations in our hands that we have currently through all the developments that's happening all around the world to improve the lives of these people who are residing in areas where it's not an exaggeration, where we can say like most of these people will never see a doctor in their lifetime. So all these experiences have been fairly life-changing as well as very, very satisfactory. And all of this has been possible not only due to technology, it's also due to our teammates, especially on our project managers side, who are coordinating and communicating and managing all these stakeholders and patients and health workers all the time. And I brought up this point because when we talk about technology, we always think in terms of tools and software and infrastructure, but we must also be very, very aware that technology by itself, it's not sufficient. We also need to have it in parallel with all the management related tasks, all the coordination related tasks that needs to be done. And there's always there's always a need of human element there. So whenever we talk about technology, we must always be aware about the human elements. And because the communities that we work in and the state of our country, and again, it's very similar to lots of countries around the world, due to the economic disparities, due to the historical facts and their history for all these marginalized communities. There's always been a sort of inequality present in our society. And with digital technology, there's a fear of those inequalities being passed on to the newer generation as well. So we must always also be aware about all these inequalities, how we address them through technology. So concepts like gender equality and social inclusion, how to include culturally and linguistically diverse communities. So all these factors, all these questions, all these important points also should be always should be taken care when we are talking about implementing digital health technology in any kind of projects. And regarding the new advancement, Raju sir brought the point of AI, and AI has been revolutionizing technology sector, science sector, all over the world. And then we can see a lot of advancement happening on the health sector as well. But we must be also be very aware about what's the hype and what's the practical uses. So most of these technologies are still in the piloting and experimentation phase and still to being cleared by the governing agencies to be used in public services. So again, we must be very aware about like what are the implications of using AIs in terms of privacy, in terms of efficacy, in terms of price, and then only make sure that AI is beneficial, and then only start using them in our own applications. And this is something as Smart Health Global we are also looking into. We want to make the lives of our health workers easier in these communities because they are already burdened with a lot of workload. So we are also looking into how we can use all the advancement in AI for our own programs as well. And beside all these programs in Nepal, I would also like to mention the programs and the activities that we're doing in Australia. We've been very active in making sure that all the linguistically and culturally diverse communities are being addressed and helped in assessing all kind of services being provided by the Australian government, especially in the healthcare side. We are running training programs for digital capacity building. We are running volunteer and mentorship programs, and also organizing different activities every month or so, through which we are reaching out to these CALD communities and making sure they are included in all the development work that's happening in the communities. And I think that sums up everything that's happening in the world of digital health, and also a brief intro into what we are doing as Smart Health Global. Thank you.
Thank you. You've given really a very comprehensive overall in such a short time, 10 minutes, every aspects of the Smart Health Global with the challenges and opportunities also. Mentioning is Nepal is an ideal scenario because of remoteness. That's what the applications of digital health is much more relevant because of the remoteness in the country. We 2/3 is mountain and people still don't have access to this, and government is very new to digital technology. They're just embracing. They're in the very early stages, so that all makes Smart Health Global role more important. And they are, I think, working as a conduit between the government with the partnership. They can't do alone, so they would be working in partnership. And I recall they definitely have established some partnership, and their approach is bottom top. They are working with the municipality rather than with the federal government, and that is exactly what they. I think I'll come back to that later. Smart Health done a lot of great things. We need to hear more from you this thing later on from you in that, Biswasji. With that note, I'd like to invite our next speaker, who is a well-known figure, Dr. S.P. Colony. He has been working with the Blink Foundation, and it's a very global name. Has been working since 2007 and very working for the health of the children, especially focused on that. And he has been country representatives and been working very in the front line of the this smart health technology or application. So with that note, it's Dr. S.P. Colony. You got another 10 minutes to share your insight and experiences. Thank you.
Thank you so much, Dr. Raju. Namaste, everybody. Thank you for this opportunity, Smart Health team. It's so good to be the part of esteemed panelists here. And also, let me wish you all the best from Nepal on the occasion of National Science Day. It's good to be convening at this moment in the time. And also tribute to the scientists who have contributed to innovation that has made our lives easier. And that continues to be the case. So my name is S.P. Colony. I, like Dr. Raju said, work for Blink Now Foundation. That's primarily education-focused organization, but we also do healthcare interventions as part of our integrated care delivery model. But part of my life has been spent in the healthcare sector, which I continue to wear as one of my hats in Nepal. And in my over 2 decades of work experience in the health sector, I focused in providing the quality access to quality care in more marginalized communities. The digital health system has been one at the core. So my experience in one of my organizations I'm involved with is of developing an integrated technology we call electronic health record system, which has the access and tracking system, and also recording and reporting systems integrated with the different aspects of healthcare delivery on at the facility level, and also connected with the community and the national health system. Briefly sharing my experience of when we started long back, it feels long back now, about a decade ago, of developing the system. Of course, we needed to work on different fronts. one on the coordination with the different stakeholders, including the government. Second, working on the technology. Third, of course, working with the human resource of how we make sure that it happens. And fourth, with the users group. Because it was a new initiative at that point of time. Times and situation is evolving now, and we see more and more use of digital technology. But at that point of time, since a lot of things were new, we had to go through the situation that any organization, when introducing something innovative, goes through, which is facing resistance, facing resource slackness that includes both financial and human resource, and the resistance on the users front and everything. But we pursued, pushed forward, and in collaboration and partnership with the government of Nepal, we put together this integrated digital technology that was implemented in a hospital setting and became a really helpful tool for Nepal, which we did on the open source. Since we did not have we didn't have competent human resource sufficiently available in the country, we actually had to hire technicians from outside of the country. We got folks come from India to work for us. But I think something good that we did was, as we initiated working on it, we also recruited young Nepali talent who would then be working on the technology side. By the time we finished rolling out the technology in our first hospital, our team on the ground was ready to take that forward. And the second hospital we rolled out the system in, our team was sufficient to do that work. So we developed and trained our human resource parallelly at the same time. On the government front, of course, there was an appetite and willingness to move forward, but as you understand, the competing priorities, prioritizing a digital technology at that point of time still becomes the case, but at that point of time was certainly a big challenge. And therefore, we had a good faith support, not other technological or financial or otherwise. But in collaboration, of course, we were able to push forward. On the user side, it was a new initiative. And I think, like Mr. Bishwas mentioned earlier, technology is not just about, the technical side of it. A lot of what goes into it is a behavioral change, and that takes a lot more effort. And one of my learnings through this implementation process is that the technology actually gives you self-motivation. On the user's front, you get self-motivated by using it, but it takes time. That does not happen until you see the results. In our case, what happened was our clinicians, our users at the hospital, were really excited when they saw a patient coming for a follow-up and seeing all the information from the history with a single click. So that became a really crucial point where, like, oh wow, this is how easy the life becomes with the use of technology. So I think we get through that, but more important for us, it still continues to be the case, is the focus on how we can utilize digital technology, not just for making the lives of providers easier, but how we can use it for improving the access, improving access to the care, improving quality of care, making healthcare more affordable, and resulting into the equity in healthcare. So that's the end game, and I see there's a huge potential working in Nepal. Of course, there may be resource limitations and otherwise, but with the efforts that the government is putting together through the strategies and guidelines, and at least starting with some resource allocations now, we have a wonderful opportunity to continue to work in this sector. And the technology can certainly be used for improving the health system and health outcomes. the end goal of the government of Nepal or any developing country, or any country for that matter, is to improve health of its population. And the digital technology can play a crucial role in improving the healthcare services, resulting in the outcome, which is improving the health of the citizens of the country. We also know the downsides of technology, um, if not paid attention to. It could be fairly expensive. We have seen the examples globally, and therefore, in the developing countries, such as in Nepal, we have an opportunity to create a system which is not expensive, which is affordable for the government, for the country, and also it can be user friendly, and decision tools can be built so that it makes the life easier and the intervention quicker and more quality focused. So I've been a part of this journey, and starting with those struggles, been fortunate enough to even receive the global award for the technology we put in place. It was Human Workforce Resilience Award in 21, I guess. So I see from my experience that things are possible. They are challenging, especially for the developing country setup, but it is possible to pursue and to improve. I think the challenge continues for any organization such as all of us, Smart Health Global or other organizations working in technology sector, how the technology can actually be utilized for improving the care. At the forefront, it looks like it is for making the access easier, but we need to think beyond that, which the technology makes it possible. But we need to have a continuous focus to work with the clinicians on the front line, and the people working on the technology side, like us. We need to work together to make that happen. Thank you. I'll be happy to add more, but let me pause here. I don't know how long I'm going.
No, I think you very well finished in just 30 seconds before Kaloniji. And thank you very much. We'll come back to you with questions anyway later on after this panel session finish the first line of speakers speaking. So now I go on to Dr. Tahim. Tahim is a very well-known academic from the Latrobe University with his PhD on cybersecurity and digital health. He is one of those scientists who is really making breakthrough innovations in the field of digital health. So I'd like to now, and before I go on, I think Koloni ji has really raised one point of that the acceptance of technology is not an issue. Everyone likes to accept the technology. Adaptability is, sometimes a big issue in a country like with Nepal remotely, the education level, ignorance, the people are not very educated. But still the technology is made so user-friendly that even browsing your fingers on the apps on the mobile, they can quickly understand. So the technology is helping in a big way to make it very user-friendly. Otherwise, it will be very difficult, early days without window to explain any technology to them, So that's a big thing. So with that note, I think I'd like to invite our next speaker, Dr. Him. Please briefly introduce, and then, you got 10 minutes to share your expertise and experiences. Thank you.
Thank you so much, Dr. Raju, for the introduction. And I would also like to thank Smart Health Global team for the invitation. I do believe that this is a very important platform, and the theme of it and the topic is really important for us to discuss, especially with the space and time we are in terms of innovation, especially in healthcare. So I'll quickly introduce myself. So my name is Tafim, and I am a teaching and research lecturer in digital health at Latrobe University. I work within the School of Psychology and Public Health. Uh, my background originally has been more on the technology side. So I started with a Bachelor of Engineering in IT, followed by a Master of IT at the University of Melbourne with a digital health specialization. And eventually I completed my PhD from the same university, which is the University of Melbourne, in healthcare cybersecurity, where I was particularly looking at the use of personal devices by clinicians and the impact it has on cybersecurity and how it contributes to data breaches and how can we actually protect patient data residing on the devices of clinicians. So the PhD ended up eventually in building a cybersecurity framework and a maturity model, which can help hospitals to improve their cybersecurity posture by implementing the controls which came from the research done during my PhD. So again, coming back to the theme itself, uh, I think as I mentioned earlier, healthcare has really transformed in the last decades or 2 decades. So again, we have seen massive innovations on the healthcare side in terms of diagnosis, treatment, but I think technology has been a game changer in the past 2 decades. We've seen, uh, right, if we see the end-to-end cycle of healthcare, right from when the patient visits a GP center, a community center, or a hospital right from their end of life. Technology plays a really central part in their healthcare. But again, there's a lot of hype of new tools being introduced into healthcare, a lot of apps and things like that. But I think we are in a point in time where we have to think about enabling people to take control of their own health journeys, and with the support of evidence-based, secure, and accessible innovations. Um, so I'll briefly talk about some of my projects and some of my learnings, especially in the space of digital health and how that has transformed the world of healthcare. So as I said, a lot of my work has been in healthcare cybersecurity. So I was looking at the use of personal devices in healthcare, and again, hearing from the other panelists, Dr. S.P. Koloni and Mr. Bishwas, I could relate to a lot of challenges. I think Australia is also same in a lot of respects, which both of them spoke about. So in my research on the use of personal devices in among clinicians, I think what stood out was again, it was not only about technology, but factors like governance and the people side of technology is equally important. So we see the human factors in cybersecurity can play a big role. And the problem in healthcare is that a lot of the technologies are not made with the user in design, and sometimes it comes directly from the technologists who do excellent at innovation in technology, but then how that translates into the actual clinical workflow, I think that is where the problem is. And again, in terms of even cybersecurity, we see a lot of the controls which are provided by the hospitals, for example, be it a dual factor authentication or having these long passwords, um, or even encrypted applications, or virtual technologies or VPN and so on. Sometimes they are not built with the user kept in mind, and that is what leads to what we know as shadow IT, where a lot of the clinicians actually don't follow the workflow which the policy suggests to them, but they have their own workflow which actually helps them within their patient care, because for them patient care is a priority. So their use of digital tools is only to make it much more easier for them to give the best possible care to their patients. And that is why even things like simple apps like WhatsApp, which we use in our day-to-day care, or Messenger or Facebook, I think these are one of the major findings of the research was a lot of doctors in Australia actually use these tools, which actually circumvent their own hospital's policy, because the hospital does have a specific secure tool, but at the end of the day, it is not kept, with keeping the user workflow in mind, and ultimately it contributes to breaches because doctors can share a lot of patient information, because we can't blame them, because ultimately they are trying to do the best for their patients. But again, everyone has to take responsibility in cybersecurity, be it the users, the technologists, the hospitals, the managements, the government. So everyone has to play that role. And again, this is where co-design comes into play, and which Dr. S.P. Colony also mentioned about. So it is about having all stakeholder groups under one roof and discussing where the problems are, and how can we introduce technology at different points in the workflow so that they actually solve the problem of the clinicians rather than making things complicated. So yeah, again, that is a big learning in terms of technology implementation, that it is ultimately about the human. So technologies are made for the human. So apart from the innovations in technology, we also have to think about how they actually translate into workflows. The other important sort of research I do want to speak about is in the space of AI. So I've done a few projects in the AI space, trying to understand the use of AI in things like a lot of you know uh, allied health settings, and also things like the um, NICU settings, or intensive care units for very young patients. And again, the learnings are quite similar in terms of we have advanced by leaps and bounds in terms of how the treatment and diagnosis has improved through the use of AI tools. But then when it comes to the actual implementation, I think users are sometimes not very happy, and sometimes a lot of issues, like in terms of quality and interoperability, really impact how AI tools have been used. Uh, and For me, I think education and training again is quite big in terms of healthcare technology implementation, because we need to train the next generation of clinicians or even patients to make the best use of technology. I think that is also a really important learning, because a well informed patient community as well as users can actually really transform the way in which technology can help in our lives. So that is also a really important point. Yeah, so I would just like to conclude by saying that we are at a tipping point at the moment where the policy frameworks and the technologies are ready, but we need to ensure that they are inclusive, secure, and trustworthy. And that means that we have to co-design with communities, we have to build literacy alongside infrastructure, and we have to embed governance into every technology we deploy. And in short, innovation must be paired with integrity if we want technology to genuinely transform healthcare for all of us. Yeah, that that's it from me from for now.
Yeah, you are on mute, I think. Dr. Raju.
Thank you, Dr. Naim, for your very enlightening this thing into the AI ethics and the cybersecurity. My daughter is a GP, and this morning I was talking to her, and she said one of the biggest problem for us is to the how these all data are stored in crowded space. And there's so much of a scam going on, and in Australia we hear now and then, in all the bank industries and like health industry, all the private info, how do we secure their data? And and if it is breached, who is responsible, to that data? So there are a lot of challenges, when everything is digitized in a way, and also confidentiality, that all things I think comes with. And with regard to what you suggested, and every speaker touched upon, was that interface between the technology and the human being. I think artificial intelligence, we all have given everything to machine learning, and we think they are developing that tool which will then allow us to connect better. I don't know that, but we'll come back that to later. But it's an interesting world we're facing in going into through the technology. I myself sometimes get amazed to see. Well, I can't imagine what's coming next. So thank you so much, Dr. Him. Now we got another speaker, Dr. Yakindra. He is a food scientist, before I invite to him, I was sharing one forum with him recently in a workshop where I was talking about emotional health, and I think the latest research, like messenger RNA, DNA, AI, there's a latest finding that our second brain is in the guts. So our gut is the second brain. The trillions of bacteria are directly connected to billions of neurons in the brain, and they are communicating directly to your overall health, whether it's the physical health or mental health or things like that. So food is become suddenly not just for fun or taste. It suddenly become a functional and more to medicinal. And in the space of digital health, I wonder whether how Dr. Yakindra sees that food is coming off the edge, to take advantage of this, and play a role in smart health. Yakindra, Dr. Yakindra, please.
Hello, good evening, everybody from Melbourne. Thank you, Dr. Raju, and all the panelists and the attendees. So, we are here on the occasion of National Science Week. Actually, started yesterday and it will go until 17th of August in Australia. And Smart Health Global actually received a funding from Australian government to organize this series of events, and one of them is this online webinar. We are actually sharing the forum, and I am actually delighted to see Dr. S.P. Colony, also one of my senior high school colleague. We studied together in Siddhanath Science Campus in Kanchanpur, Mahendranagar in Nepal, our western part of Nepal. And I'm delighted to be here to speak on mainly food, nutrition, and its connection to health. Uh, Introducing myself, I was born in actually at a small village in Cham district of Nepal, far western part of Nepal, and moved to Kailali. And I finished my undergrad in food science, food technology from Central Campus of Technology, Dharan, and worked in government of Nepal almost more than a decade, almost 13 years. And during that time, I did my master's from Thailand in food engineering and bioprocess technology, and came to Australia for my PhD, and actually stayed here almost 12 years now. And Dr. Raju Adhikari was my PhD co-supervisor. So here we are still working together in the similar space. So he's a supervisor as well as mentor. And actually, food, one of the vital aspects, element of life. Actually, uh, good food is very essential for good health. There is a growing concern about healthy eating nowadays. So we are promoting Nourish Nation Foundation. We started in 2020, just before. No, it was during COVID actually. During COVID time, people were actually very anxious and uncertain about what will happen. And at that time, we thought maybe it would be a good idea to promote healthy eating as well as immune boosting sort of food, and how to keep them, how to actually adopt food safety habits to prevent any infections, etc. So that was initial motive to start the foundation. uh, I actually worked in different areas here. I worked in CSIRO, and currently working in La Trobe University as a research fellow, basically promoting healthy diets, plant-based foods. Uh, and the research shows that actually plant-based diet is not only healthy to the body but also to the planet. So actually, to grow uh, meat actually requires more than 6 times the resources than grow plant or the plant protein at the same scale. Whether there is a variation in digestibility, bioavailability, etc., but in the quantity actually it is more sustainable and less energy intensive. So it's good for the planet as well as good for the human body. And through Nourish Nation Foundation, we actually go to different communities throughout Australia. We organize several seminars, webinars, food expos, multicultural food festival, etc., just to promote the healthy eating habits. We from the workshop, we know that people have very little understanding on uh, even the basic role of food ingredients or the mainly the nutrients, how they are actually absorbed in the body, or how actually they get transformed while processing. Uh, that is what we understood, and we are actually mapping the BMI also during our workshop, basically body mass index. So it actually indicates some sort of the obesity or what the degree of obesity the person has. So that is an indicator of actually the health consequences in the future. So that's where if we can actually keep our health on track by adopting lifestyle and diet, good lifestyle and diet, then definitely the health burden can be actually reduced in the future. Though that will be our work is mostly on the preventative sector. So making people aware about the healthy food eating habits. We are now trying to promote some what you call the blend of a whole holistic approach of health actually, food, nutrition, lifestyle, spirituality, and actually the uh, connection between different cultures and food, that sort of thing we are working on. And we have also received several funding from different state government and federal government, and working closely with Smart Health Global in this space, basically trying to utilize their technical expertise, how we can integrate our this nutrition knowledge and monitoring in digital system, so that actually we are planning in next year definitely to integrate getting the data from the communities in Nepal. What is the nutritional status of the people? Yeah, I will stop here. So we'll come back later. Thank you very much.
Yeah, thank you, Dr. Yakindra. I must add few words to what Nourish Nation Foundation is doing. I think lately in some of the workshop, which was government funded, I think Nourish Nation has been advocating about the significance of nutrition. Especially as Biswas mentioned about culturally and linguistically diverse communities. The community diversity, in a way, is a very strength, but itself is a challenge. So, trying to explain different migrant groups, they bring their own culture of food and habits. And it's been found by the research that they are prone to early exposure to diabetes, obesity, heart problems in Australia. Due to their lifestyle and changing food habits. So the Nourish Nation has been using that. And of course, I think also AI will come in a big way to blockchain and all things, to make food secure, and also, the nutrition's reach to even the common people. in a way, so that Naresh has got a bigger role to play. And I think we'll ask him some more questions in the second hours in the next part of our session. So with his note, I think we have finished the first part of our 10 minutes of each panel member sharing their experiences in regard to the smart health, which is kind of a digital health, we call it, or telehealth in the modern knowledge age, DNA age, we all going into. So now I will also follow a similar order when asking questions. As I started in the first part of the session. So I'll go to Biswas for the question. This is questions from Smart Health Global perspective. So it is an internal question designed because we wanted to get as much information and feedback from you into Smart Health Global, so that we get our programs developed, more friendly and efficiently into future, and also work with you, knowing your expertise and backgrounds and knowledge, and that will pave a way to us to work together as well. So these questions are designed to ask you some hard questions, but later on we'll open the question to a Q&A session. So to Biswasji, you very in the 10 minutes you talked about the opportunities, the challenges, especially in the context of Nepal, the everything from your partnership, your initiative, and going into remote. I think in the last, it's been only few years, which is more than enough to say that you have gathered how much of data you have gathered from your experiences. But how do you see the real challenges, taking Smart Health Global, not only app-based information sharing and connecting community with the GPs, and getting into the very first diagnostic in the maternal care or child care. But what other areas, like as I remember, in a Smart Health Global, we discuss also while talking to these patients which are nutritionally deficient, living in the remote, they are also emotionally very vulnerable. They are very prone to mental health issues. So do you think the Smart Health go holistically, also taking mental health while, dealing with the physical health? That's one question. And secondly, what are the real challenges, resource constraint to partnership, to collaboration, to working with the community directly on the ground zero? So please give us more insight, what you expect, what's happening, and what would happen.
Thank you, Dr. Raju, for the question. And starting with the first question about emotional vulnerability and how patients relate to digital technologies, it's a very interesting question. And while you frame the question in context of Nepal, through all my experiences with working in public health sector side of things for past 10 years and also living and studying around the world, um, I've seen that this particular issue with having and not having a connection with digital technology is prevalent in all kinds of society. It doesn't need to be an underdeveloped society. I've lived in Estonia for a year during my master's program, and Estonia is one of the most digitally advanced country in the world. It always ranks in the top 3 in UN's yearly digital governance rankings. And there itself, during one of our research project, I still remember the exact term told by one of our participants in the research. The person told that, "I don't want to talk to a machine." And this statement came from a person of a country which is supposed to be one of the most digitally advanced country in the world. And so not just in Estonia, I've seen similar sentiments in Germany, in Belgium, in various countries, in South Asia, in Africa. So it's always the same. Like people wants to have an emotional connection with the person that is trying to provide you help. The help can be about your health, your mental health, or even like emotional support. But coming to the question, recently we also saw the another aspect of this question. So while using the digital health technology, there's always a disconnect between the provider and the recipient. But recently we had a case in our own system where the person had a really high blood pressure, and there, like, she needed some kind of assurance that everything's gonna be okay. And this assurance was being provided by one of our doctors based in Kathmandu. And she reported that even her presence through our app and her words of assurances was sufficient enough to keep her calm, keep her like controlled till like additional help arrived and started providing her help for her health condition. And there's a really good blog on our website if anyone wants to check it out. So I've seen both sides of this thing. Like digital technology can also be a disconnect as well as a connect. So we must be very aware about how we are using technology. As with any kind of science, like there's a bad aspect, there's a good aspect, but we must be very aware about how we're going to use it and try to minimize the bad aspect of the technology. So there comes your question about how we can support the communities on emotional side of thing, on the mental health side of thing. Even if we cannot like provide, let's say, psychological support or pharmacological support for their health condition, we can always have some kind of emotional support through the presence of a qualified health professional. And we've seen it all, right? Especially in the context of countries like Nepal, doctors are considered God, and like patients line up just to hear like few lines from the doctors to just to be assured that their health is good. And this is a very prevalent belief in most of the areas that we are working in. And we see that like there's a big difference between the same thing being told by the local health worker and a doctor or a specialist. So this way this can be a stepping stone where we can build upon providing additional help in terms of their mental health, their holistic health, tying it to nutrition, tying it to economic activities, like the work that Dr. S.P. Colony is doing through his foundation. Because again, when you talk about health, it's not just about like the diseases and curing it. Like there's a lot of different aspects like sociological aspect, economic aspect. So again, we can start digital health, just the digital support, the emotional support as a stepping stone, and then build upon it. And coming to the second question that you had about the different kind of challenges that we face, again, there are technical and non-technical challenges. Technical, we have to face challenges like the unavailability of internet connections, power outages, and then also no proper digital devices being present in the health facilities, and also the digital capacity of the health worker themselves. So these are all the technical aspect, and there are always ways to like work around it. If there's no direct power connection to the health facility, we can use solar power to power the digital devices. If there's no internet connection through cable or fiber, we can use the 3G connection. So, but there are still some areas where we couldn't, there's no even mobile phone connection. So again, there are certain technological limitations which we cannot work around, but always, most of the time, we can always work around. If there's like capacity building challenges, we can train the health workers. We have had a really successful experiences with training health workers online, which is exactly opposite way most of the organizations have been training their people. They go to the facilities themselves, to the localities themselves, and like conduct training programs for days. But we've been successfully doing the same online, and we've shown that it can be done online very, very successfully. And then there are non-technological challenges. Dr. Kolomni, Dr. Wani also touched upon these topics, things like stakeholder management, managing expectations, the economical aspects of things. So there's this line that I always repeat at the end of any workshops or talks or any kind of program that I'm like invited to, and it goes like, tech is easy and humans are harder, right? Again, I'm like exaggerating the tech side of things. Tech is easy for me because I'm an engineer, but again, in my experience, all these years, I've seen that the human factors are always harder to deal with because there are so many stakeholders from different aspects, different um, domains that need to be taken care of. They need to be heard, they need to be addressed, and their advices and suggestions need to be taken care of, and also make sure that all of their expectations are managed not only at the start but throughout the lifeline of the project. So, and then there's also the challenges with policies of the government. Fortunately, Nepal's government has been like advancing a lot on making new rules and regulations. But again, the problem in Nepal is that there are a lot of nice rules and regulations, but nobody pays attention to the implementation and enforcement of that. So there are again all these non-technology challenges as well, which in my belief is much more challenging than the technical ones. But again, what's fun if there are no challenges, right? So we are learning, we've been learning, and we're learning to how to address these challenges and having successes as we go on.
Yeah, thank you, Dr. Biswas. It's a very learning process anyway. And as you mentioned, I think each individual is different. I was told that genetically, 8.5 billion population we have, they are all different. Their emotions are different. Their DNA makes them so different. They are allergic to one drug to not to. Some are, introvert, some are. So this is a very complex issue to deal with, even if you have a technology to take it to different people, response in a way. And also, like you mentioned about this, the food, I will come back there to Dr. Yakindra later, that I think food also, while you giving them the physical consultation about their health, you would mention about that taking also sharing mental health, emotional, consultation, plus, sharing the good nutritional food, for them to, take. So you're taking a pluralistic and holistic approach. That's a very integrated approach, and I think that really makes it Smart Health Global Strategy very, comprehensive, while it is multidisciplinary at the same time. You're working with different people. Now, I think I'll come back that to later with another question, but now I'll go to Colony, SP Colony, Dr. Colony, that how your focus has been mainly on the children's, but then lately, taking that to different age group, from people. And also, how do you compare the Nepal perspective to other our neighboring SAARC countries? How do you see countries like Bangladesh, the Pakistan, who are on similar health front like us? Are they doing better, or there's something to learn from them, or they have to learn from us? What's your experiences in comparison to the neighboring countries?
Thank you, Dr. Raju. I especially appreciate your bringing the genetic aspect in between our conversation, which is awesome. Thank you. Well, in terms of where we stand in our neighboring countries, I think each country is trying its best to move to advance in the use of digital technology for improving healthcare. I think there are a lot of similarities. For example, the process that the countries are adopting, the acceptance the countries are getting of the digital technology, the challenges each of these neighboring countries are facing. There are a lot of similarities. And also there are some unique situations that Nepal has, for example, that we have recently undergone the decentralization process in the country. And so now we have the federal, provincial, and local governments that provides a unique kind of perspective that we have, and also both challenges and opportunities. I would see more on the opportunity side of this decentralization process. And so where we stand, and if we compare that with the neighboring countries, I think Nepal has I think, like Dr. Biswas mentioned earlier about the progress in the policy front, there have been a few policy documents put forward. We have now the digital health strategy put in place in 2017, I guess. And then we also came up with, the country has developed the national framework for use of the digital technology. And there are guidelines created, protocols being developed, and some new initiatives in terms of how this can be more standardized process moving forward. So, for example, the Digital Nepal framework provides a longer term approach of what Nepal should look like in not just like next 5-10 years, but if we look at 2100, a longer term vision of the country, and what is our path forward. So, which is an amazing a guiding approach. But at the same time, the strategy in place that actually helps the country to move forward in a certain path. I think what is big challenge is, again, echoing with the previous speaker on the implementation side of our work. In Nepal, this probably is one of the unique situations of we have very advanced, very progressive policy landscape, but our implementation lags behind significantly. If you look at our constitution, if you look at our acts, our policies and guidelines, they are far advanced than what we see the implementation on the ground. So that aspect of lacking creates a huge gap in terms of where people's aspirations are and what people are really experiencing, what the citizens are experiencing on the real ground. Whether it is about providing the quality care from the facilities or making healthcare accessible to the people, or you talk about the use of digital technology to make it easier. In all of these fronts, what we lack is a determination to actually implement what we have in place. Of course, I wouldn't say that we're in a perfect setup in terms of where the policy needs to be, or the structure of the governance would be like. But we're much advanced in that front if you compare that with what is being practiced on the ground. So that leaves us with the room for improvement, which I also consider as, there's a saying, gap as the opportunity or need as the opportunity. That's where the organizations like Smart Health Global and any other organizations, whether you talk about Health Nepal or any other organizations, could actually really contribute in terms of building the innovation and building the systems. It's a very much untapped potential as developing countries. Each of the countries that you just mentioned, whether you talk about Pakistan or Bangladesh or Nepal, each of these countries have huge potential to actually form a strong foundation. We also know from the global experience what are not to do's and what are to do's. As I mentioned earlier, the technology can make healthcare fairly expensive. We have seen that kind of examples. We talk about the developed countries like USA. The healthcare becomes unaffordable because one of the contributing factor becomes disintegrated digital technologies use. So we have now the opportunity. This is a common opportunity and challenge both for these developing countries, for these neighboring countries to Nepal, that we set a very strong foundation with the standardized and open source platform created digital technology that is sustainable, that is secure, that is interoperable, but that's affordable for the countries in a longer run as well. So these, I think we can tap into the common challenges as the opportunities and work together. That's another opportunity we have, even in India, which is a little further advanced in terms of use of digital technology, but there are opportunities for us to work together in building those kind of systems and share the learning with each other. And the progress, the struggles is the country has been going through, and come up with the right solution for their local context. I wouldn't say that we use the same tools, same technology across the border, but there can certainly be a strong learning sharing, which will help each other in this region in terms of learning from each other. Um, the also the potential, if you see, of the untapped potential of how we can create human resource, that's also been touched upon earlier. The focus needs to be developing human resources moving forward, because this is not only about creating a human resource which can operate the technology, but creating an opportunity for people to create more employment through the technology. I think we need to think broadly and widely in terms of the use of technology. And therefore, I think the countries like Nepal, which has got a rampant growth in terms of use of technology, whether you talk about cell phone, you talk about the internet, the community radio has become one of the examples of spreading, quick spreading of the radio communications in the country, in the region. So these opportunities can be utilized for building the technology. And also, I would also highlight the aspect how we can make the healthcare accessible to more marginalized communities. It is amazing to see how the cell phone use has been grown significantly, and the access to cell phone of a huge population of the country. So it is now very uncommon to see anyone in the country who would have lack of access to cell phone. But how can we actually make the utilize that kind of opportunity for building a system that can make the service, that can make healthcare accessible to people, is the opportunity and both challenge for us to look into. And speaking of the countries around, I think these are the common situations that we all can actually work in. And Nepal, as has decentralized recently, the local, federal, and provincial governments can actually work within their scope of area of the administrative zones to actually build those strong foundations for others to learn from. Thank you.
Thank you, SP Colony. I think very insightful thoughts on the challenges in and around the Asian country. I think you rightly mentioned that the Asian countries always can develop cheaper apps, cheaper higher technology like drugs, generic drugs which come. So the Asian country has got, and they are very knowledgeable. And the IT sector you mentioned in Nepal, IT has become one of the second largest after tourism. Even it's overshadowing the tourism industry, which is supposed to be our backbone of economy. So, and so in a way, I think the Asian country can really take a quantum jump in taking lead in this area. And also, as you mentioned, that the health industry is going to be one of the most expensive industry, up to $3 trillion by another 10 years time. So the AI, there's a lot of expectation. And as when we talk through the AI, there's been, you heard seen in the news that how we work together in AI. The countries are, putting fund together and resources together. So likewise, at the ground level, organization like yours and Smart Health Global, I think, and also in neighboring countries, it's good to go in partnership and collaborate and mobilize resources. I think that's you rightly touched upon, and thank you very much for your insight. Now I'll go to Dr. Tahim, about the Latrobe University. I think since you come back from Melbourne to Latrobe, how you see the academics playing a major role in the Australian digital health policy. Are they listening to the academics, and are they really giving you enough funding? And how do you see the Australia is better in place in taking the digital health compared to other countries in the developing world? And as an academics, how do you see those challenges and opportunities?
Thank you, Dr. Raju, for the question. I'll start with the first question about La Trobe University. I think Um, uh, One of the things I could say about our school, which is the School of Psychology and Public Health, that again, it is at the forefront of a lot of innovation happening in health, health research and even research in digital health spaces. So we've um, as part of the faculty, we've or the school, we've got experts in different areas. And again, as you would know, that every research based in health has a digital angle as well. So this is where the power of collaboration comes into play. So there has been a lot of um, research done of how, for example, uh, digital health tools can improve equity among different groups, especially virtual care has been quite big. So there was a project, as you would have probably known about, which is called the Virtual Emergency Department, which was a big takeoff since COVID-19 pandemic, and it started as a pilot at Northern Health. But then, since it has really expanded, it was led by Professor James Boyd, who's our head of cluster. And again, there's a strong multidisciplinary team behind it, and similar initiatives in palliative care and AI and other spaces. So we've also seen that La Trobe has heavily invested in the use of AI in medical innovation. So recently there was a new center opened, as again some of my La Trobe colleagues here might have known about, which is called ACAMI, the Australian Center for Advanced Medical Innovation through the use of AI. So again, I might have got the full form wrong, but it's more about the use of AI in medical innovation. And we are also trying to leverage the use of infrastructure. So La Trobe has had, massive investments in its computing infrastructure. So we've got a supercomputer which can really help transform, the use of AI, especially in medical innovation. So La Trobe is doing a lot of things. But again, having said that, there are challenges in terms of again, how the research landscape has changed globally in terms of lack of funding and so on. So these challenges do exist. But having said that, again, has been a lot of research done. And the good thing is that a lot of good work is also happening in the education space. And personally speaking, we have been in a part of a project. Me with my other colleagues, we're trying to understand the status of digital health education in Australia. So there was a manuscript which we recently submitted and is undergoing the last stages of revision, which I led. And sorry, so we're just trying to understand how different universities are offering digital health courses, where the gaps are, which areas are not covered appropriately. And then eventually we're also listening to the experts in the industry and the research space of, how can we create a strong workforce in Australia? And that requires strong digital health literacy. So previously we've seen the area of digital health was more like a generalist role where people from the clinical sciences or maybe technologists would actually take up this role. But then now we are in a space where we have a space for digital health specialists who understand the technology part and the health part as well. So this is what we are trying to create to create the new generation of digital health specialists who understand the health context and who understand technology as well. So there's a lot of research happening in our university in that space as well, of how Australian universities can generate digital health specialists. As far as Australian policies are concerned, in terms of digital health, I would say we are in a better space as compared to some of the developing countries, but not really at the top in countries like Singapore and Denmark and some of the other European countries are much ahead in this space in the sense that you know uh, of how they are in terms of interoperability, regulation in AI, and so on. But again, we are in a fairly good space where there are multiple opportunities. But having said that, again, one of the key challenges, which is perhaps common to both developing countries and even Australia is equity, and again, a lot of the rural population and even marginalized populations, people from called communities, Aboriginal and Torres Island Straits people, again, they are facing a lot of gaps. There's a big digital divide, which again, they perhaps can't access healthcare the same way in which we are. But having said that, Australia is taking steps in that direction. So in the recent National Digital Health Strategy, which I think came out in late 2022, and it was a roadmap or plan from the year 2023 to 2028. One of the key uh, uh, aims or core outcomes was equity and inclusiveness, uh, and the federal and the local governments are also trying to close the gap between these marginalized population, especially the Aboriginal and Strait Island people, and with other Australians, and try to create culturally safe governance and data practices. So, and again, we've seen a lot of national scale initiatives after the COVID-19 pandemic. There was a huge uptake of virtual care, especially telehealth. It was a massive pickup. It was really sluggish before COVID-19, but then since COVID happened, it has really taken up. I think people from the rural communities have really benefited from this expansion. There's a lot of integration of what we call as consumer-centered care. So we are in a space now where we're trying to empower consumers more in terms of taking care of their own health. So they're using their personal devices. They've got a lot, access to a lot of government services through apps and other means, so that they can also take part in their own healthcare. And then again, Australia is one of the place which has sort of good accessibility to infrastructure. So we've seen subsidized broadband plans, and almost all of Australia more or less has access to a device, which is good to see. But then having said that, there are a lot of challenges as well, because literacy again is a big challenge, because people from these called communities or Aboriginal communities, they might not have the same literacy skills as compared to some of the other population, which comes out as a massive gap. So even though they might have a device, but then they are not using it in the best possible way that they can use for their own healthcare. Um, Privacy and security is also a big one, because healthcare is the most breached industry. So it sees the most number of data breaches across any of the other industries in Australia and even worldwide. So we've seen, you know, uh, you might have heard of massive breaches like the Medibank insurance data breach. A lot of hospitals are being breached. And again, it comes from non-state political actors. It can come from hackers and other spaces, or even internal factors as well. But there's a massive challenge which we face in terms of data privacy and security. And now with the advent of AI, all the breaches are ever so increasing, and hackers are much more capable now in terms of their capabilities of doing a breach. But on the other side, we are not keeping pace with this AI transformation and innovation in terms of responding to the same breaches. Um, yeah, I think those are perhaps the sort of main challenges, but we are perhaps at a good space in terms of countering those challenges if we take the right steps in the next few years.
Thank you, Dr. Tahim. I think you cover most of the things we're really looking to hear from you, and it's quite intriguing, and very complex thing, especially with the security and privacy. As you see, Australia is a very well known for biosecurity, in CSR. I remember 10 years, 20 years, 15 years ago, we started this project biosecurity, and even with the trade war with Trump, you can say that we are not importing, despite the AI is helping to track, you call it blockchain, technology helping to, everything to monitor the security and safety of the food. but still Australia is very sensitive about biosecurity. And as you mentioned also in regard to cultural CAL communities, I think these technology has to be customized and developed in their own languages to some extent. Otherwise, sometimes you try to take them in the English, and it's very difficult, and some misinterpretation or misunderstanding might also create. It's a health issue, you got to really go down to the level of the understanding. The other thing which I think I was also in LETRO for a while as an adjunct research fellow for a specific project, and LETRO and Smart Health Global, our CEO Manoj is also from LETRO. He undergraduated or postgraduated recently from LETRO. And we are thinking of exploring opportunities and avenues to work with LETRO and taking their expertise to Nepal and work collaboratively in future. I find you as the best link, and in the future we won't be talking to you privately whether there's such an opportunity where these two organizations can work together and for the better this thing. With that note, I'll come back to Dr. Yakindra Timilsina. I think the food as his organization has been advocating the importance of fund as the fundamental, and then the AI technology he's looking at it, helping him in a big way in making food safe, transporting food safe, and especially in countries like the awareness campaign, in a big way. So what are the challenges, Dr. Yakindra, you see that and you face while talking about the important significance of the raising awareness in Nepal in a conventional way, and how do you see that the cultural, the sensitivity around, and then how AI will help you to what you want to achieve in Nepal, raising this importance and significance of food in overall health. So what do you see, AI as a friend or as a enemy or as a bit of both?
Thank you, Dr. Raj Adhikari. Yeah, actually, yeah, definitely AI is playing a vital role, especially in every aspect of life. I think, yeah, like I'm also using a lot in making my life easier, mainly in drafting, scratching, writing, and things like that. But definitely, we need to be aware of the information generated. That is one of the key challenges. And I am actually looking into a lot of the social media misinformation these days. Basically, there are a lot of gurus in social medias who are actually spreading the misinformation to the community in terms of what they should eat and what they not to eat, things like that. But they are all not backed up by any science. They are just trying to get more views and the likes, I think. So that is one of the challenges I'm facing. And then I was going through some of the informations, how they actually get them from. They don't have any scientific evidence. So we need to actually raise the awareness and actually utilize the social media to actually counter these misinformation. So that would be one of the way to make community safer. The other thing, actually, I was looking into the wearable technologies and the advancement to track the nutritional needs, the calorie intakes, etc. There are a lot of applications available, and but they are some are actually they attach with a subscription fee, and some are free. But I haven't actually looked into the reliability, etc. But they are heavily used with several subscriptions. So I actually was thinking about like whether there is any way to just monitor the calorific value of food without actually eating it. And then I saw like barcode scanner or something. Just they actually tell some numbers, what calorie it contains, and whether it can give any useful information about the micronutrients such as vitamins, minerals, etc. Also, and whether that is enough for the day, the diet daily intake requirement or not. So and that area also is actually growing a lot. I think a lot of people are becoming more aware about the food and its actually direct impact to the health and well-being of the people. But still, there is a need to actually address some of the issues, because the food has a direct connection with the culture, and then we actually need to respect the cultural significance of the food also. And we actually don't have many information about our food, basically the South Asian food, or the plate, what actually it has, and how we can actually improve the cooking habits or the eating habits, etc. So that area actually need a lot of intervention or the awareness, etc. So that's what Nourish Nation Foundation actually wants to work with wider communities to disseminate the right information. And in this aspect, actually, digital health technology could be one of the way to intervene. And as Dr. Raju Adhikari, you are yourself is a CEO of the Nourish Nation Foundation, and you can actually add some of the points what you envision how we can actually work in Nepal. Basically, my understanding is one thing is the malnourishment is a problem in the rural regional area. The other is actually the overnutrition or the obesity, the diabetes, heart, cardiovascular disease, etc. So these are growing, and because of the food intake and the sedentary lifestyle. So that's where we actually need our intervention. And I was looking into the salt intake also of our community. We have actually more than double the amount of the salt than recommended by WHO, because we have salt in dal or the soup and vegetables, chutneys, or pickles and everything. So the salt intake actually increased a lot in the as you know that sugar is another big problem. So we have actually taken our diet contains a lot of carbs, and we have tea everywhere. If you visit maybe friends, families, anywhere, so the first thing is we offer you tea. Then that is also with a lot of sugar. So that's where actually we need to address that issue also, how we can actually encourage people to reduce the use of high salt and sugar and adopt a healthy lifestyle. So up to you, or you can add some more, Dr. Raj Dikari.
Thank you, Dr. Yakinta. I think you raised very pertinent point. As I see, he asked me to add few points. I think the advocacy awareness campaign is the best way, and that we can do easily using AI. I can see, in the last 10 years, how dietitian, diet industry in food, especially, people trying to look good, slim, lose weight and all, is using AI or information, social media in such an aggressive way. This industry is growing at a, compound annual growth 6.1% to almost like $1 trillion now, 600, $800 billion in no time. So people, as you can see, have been brainwashed to a large extent for commercial purpose and using AI. That's what I was saying, the misuse of AI. But while Yakindra mentioned also that we need to counter that, and evidence-based, like CSRO come up with the CSRO Diet book, which is the third largest Amazon selling book. But we never thought that we would come up with that book, but that book come out to be one of the experimentally, as Yakindra mentioned, evidence-based research, where you may not be brainwashed to the extent, you just, so this is kind of things, I think Nourish Nation Foundation has to take this, the mission of taking this nutrition, that to the common people through very right evidence-based advocacy, and also, they are taking some data from the culturally diverse community here wherever they work. They conduct workshop like he mentioned about BMI, BMR. So these are all research data. They are creating their own database so that they can take and share this information. I think the AI can help the food. Food is an addiction. It's very difficult to brainwash people, change the people food habit. But once they are in the danger zone, then they are being brainwashed to large extent. Where otherwise they are in comfortable zone. So we need to take this nutrition as the in a big way, and Nourish Nation needs to be congratulated under Dr. Yakindra leadership, and working with the Smart Health is one of our strategic partnership. There's the reason that two organizations are working together is that because they are so complementing, and as Biswasji also mentioned that educating while consulting community on health, telling them, sharing about nutrition also is a part of Smart Health Global. So there's a very good interface coming in partnership through different expertise. So I think we have got 10 minutes left, and I was looking at the chat box. I think it seems a lot of the time on these technical, sometimes you don't get many questions. While we wait for any questions to come in, I think we still got 10 minutes to go. So what I like to do is that I would ask each of the panel member what one or two messages you think Australia in your area of expertise needs to be done, and there's a gap, and what exactly needs to be done in the next 1 or 2 years time. One key subtle message, so that we can share this information, and then work together. So I will start again in the same order. Biswas, what do you think is the key message Smart Health Global would like to give to the world outside, global message? What is that message, and what's your point on that?
So if I have to select just one, I mean, there's a lot I want to get out
You
to
can
the
pick up
world.
1 or 2, 3, but the key ones, yeah.
Of
The
course.
fundamental.
So to be very focused on our particular context, is that uh, we deal with a lot of adversity here in terms of geography, in terms of our economic history, in terms of our political history. There's inequalities in terms of education, genders, social disparities, and so much other things, which contributes to sorry, which contributes to the condition of the health service, the health system that we have today, where a large portion of the population is still not do not have the access to a proper health service. And I'm not even talking about like a really good health service. Even the basic health service is out of the reach of a big chunk of our population. So uh, till now, the only way out being thought by all the policymakers and the implementers were always focused on physical infrastructure. They always thought about making roads. They always thought about making hospitals and stuff. But with digital technology, we have a easier way out. We can easily implement digital technologies where roads will still take years to come to reach those to those areas. So again, this is a message out to all the implementers, to policymakers, to researchers, and also to the broader development community. Please try to use more of the digital innovation, invest more, partner more. And when I say partner, both in the implementation and on the academic side, and focus on digital technology to improve the conditions for these kind of communities, and not just in Nepal. I'm talking about all over the world. So digital technology is always the easier way out to reach and improve the lives of the people in these kind of communities. And again, and another really important message I want to send out to everyone working and everyone thinking of working on digital health technology, and especially to decision makers up in the chain, in government level, in the policy level, is that till now, everyone thinks of digital health or digital technology as one of the aspects of the existing system, right? But if you see around the world, digital technology isn't a new aspect or a new incomer. It's slowly becoming the default. We no longer think about sending letters using paper and pen. It's always email or sending messages through your mobile device. Communication is always through digital technology. We never think about like other technologies or other way of communications now. So in the same way, in health sector as well, digital is the default. So we need to always think that digital is not no longer optional going forward. If you want to think about the future, if you want to think about moving ahead, digital is not optional. It should be the default. So if everyone starts thinking in that way, then I think there's a lot that can be done in coming years. And I think that sums up my 2 points. Thanks.
Thank you very much. I think you really nailed down the key message. And I'll go over to Dr. S.P. Coloni. So one or two messages from your Blink Organization Foundation, or overall, your own perspective. What do you think are the one or two key messages?
Thank you, Dr. Raju. I think I'd sum it up in 2-3 contexts. One, something Dr. Akindra mentioned earlier about the misinformation going on. I think we need to be really careful about what's going on in the world right now with the use of social media. We have shifted in the burden of disease. If we look at the data in last couple of decades, we see 2/3 of global deaths and disabilities being caused by the non-communicable diseases now. Now, our resource focus is still on the communicable side in terms of interventions. If you look at times, we have different kind of interventions going on in isolation. So we need to integrate them together. So I would sum it up by saying also one of the reference to our nutrition plan, as through the multisectoral nutrition plan, we made some improvement in stunning and wasting, but that's still, if you look at the disaggregated information of different provinces and municipalities, we find so much of a gap and divide. So looking at all this situation, I would say we should address the misinformation, prevent from the misuse of technology, create multi-sectoral plans, learn from the global experiences, but develop local solutions, and partner, work with each other. I think that's really key at this point of time, and aim at the larger outcome of improving health. I think we have to bear that in mind, because at times my experience is we get lost into the weeds of doing the day-to-days, and the larger picture is missing. So if we work in this, I think we can all advance together. Thank you.
Thank you, Dr. S. Picolini. I think it's a very powerful messages you have given. I'll go over to now Dr. Tahim. You have one or two key messages as a cybersecurity expert. How do you see AI messages to us?
Thank you, Dr. Raju. So I think I would just reinforce the points which the earlier speakers have made about, now we are in a phase of consumer-centered or consumer-powered care. So we've obviously given more power to the consumer. We do want them to participate in their healthcare, and we want them to take care of, of their healthcare information and data. So, which means that we do have to work really closely with them in terms of how we design solutions. But on the other side, I think there's a downside as well, in the sense that with this massive uptake of AI, I would say that there is a potential of a lot of misinformation happening in the healthcare space, and for that we need to be very proactive. So we need to create high risk AI guardrails in terms of developing healthcare frameworks for responsible AI. We have seen that there has been some work done in terms of developing AI governance frameworks, but more needs to be done in that space. And I think privacy and security should be the default design. So we should always keep that in mind, especially in cybersecurity. We have an activity called the red teaming and blue teaming, where one team pretends that they are the hacker, other team tries to protect. So we need something like this, where we have these exercises where we take the perspective of the adverse party trying to break into a system, and then think how they would think, and then build systems who would be resilient of countering those challenges. So I think that is really, really important, that privacy is our center, at the center of our design, because AI enables even hackers and non-state actors and other parties to be really, really powerful. So we have to be much of a step ahead, as far as protecting ourselves is concerned. So yeah, I think that would be my two key messages.
Thank you. I think you're right. I think that's what Australia government is, in the National Science Week, they are promoting STEM, everyone to learn science, engineering, math to understand better. So I think, thank you, Dr. Tahim. And now I'll go back finally to Dr. Yakindra. What one or two key messages you have from Nourish Nation Foundation to this team and to the global message for everyone?
Yeah, thank you, Dr. Rajadhikari. Definitely, food is a fundamental right. Actually, the government has obligation to provide nutritious food to everyone. So that's where actually we need to work, all the philanthropic organization or the scientists, everyone. We It's very this heartening message that almost 1 billion people actually go to bed hungry stomach every day. So there is a need to feed more people. So the productivity or the growth need to be increased. At the same time, how we can ensure the food is not lost, or the loss of the food on the table on the farm and the supply chain need to be reduced, that need to be worked out, and we need to provide nutritious food to everyone. So the right to information, so the need to be provided to everyone using these digital technologies, and the right information if we can provide to people, and they will have an informed choice to take. So the is up to the individual, but definitely as it is related to the national health, so we have to promote healthy eating habits, and with knowledge of nutrition. And as Dr. Kaloni mentioned, that actually the collaboration is vital. So we actually, when work together, then we can achieve the better goal. So definitely we should collaborate with each other. Thank you.
Thank you, Dr. Yakindra. I think in line, I'm just looking at the chat box since there's no question. So I'll just also like to mention that the CEO of Smart Health Global, Manoj, is a participant. He was a bit busy because there were a few guests coming from Nepal. There were the mayors of the 4 different councils visiting first time to Australia to watch how the council works here in terms of smart health. and share their experiences and take home some of the key learnings and partnerships. So they are here, so he must be looking after them. Very busy man, but I think he told me that he will be participating in the session. If he's there, he would be listening. So I think now I come to the very final part of the session, that is the summary of the session. I think this session, in a way, has enlightened me in a very big way. I came into thinking that it'll be too technical, but it was not only too technical, it was really very informative. And this information was so shared in a way that even a layman can understand, and take home messages. So from the Smart Health Global, I think Biswas said that digital health is a necessity, is a default. I think there's no way going back or thinking twice. Is the way for, is the necessity, and policy and has to be AI friendly, I mean, digital health friendly in Nepal, especially in a country like we are very late starter. The science in Nepal started very late in 60s, and we're catching up with this. So we were left behind. So we don't want that to be happen, as according to Biswasji. It should be policies should be formulated in at par with the global level. And also that for that no more investment is needed. I think very key powerful messages come. And from Dr. SP Coloni, I think he talked about, I think the message from him was that the misinformation, and that is, more, counterproductive than what we're trying to achieve. So, and he also emphasized on integrated, early intervention and integrated way approach. And also, I think multi-sectoral, this thing, and global experience, take the global experience, work together, but find a local solution. I think that is a very powerful special, and look for the larger outcome, because we don't know what happens in 5 years' time. Look back, they said even the mobile phone will be disappeared. So looking at the larger outcome is, I think that thinking big is the way forward. So it's a very powerful message from Dr. S.P. Coloni. And Dr. Tahim, as you mentioned about the AI governance, I think the government, even while using the AI, or people, the other industry misusing the AI, I think there's a big questions already in Parliament in discussion globally about the AI governance and the framework. Privacy and security, these things are in the front line of the policy, whether there would be some legislation coming in Australia, especially Australia has banned YouTube, up to 16 years of children, and they're not allowed to take mobile into school nowadays. So he really touched upon that the governance and the EI legislation or policy framework is very important. The privacy, security, while we making use of this technology, I think that has to go in hand to hand. And the university like La Trobe and academics are playing a big role in that. While the industry, the Meta or Google's or Amazon's, they're sitting on top of the AI. But I hope they will be giving us some funding to La Trobe also to do some of the research. So that's a very powerful message. And the food, Dr. Yakinda said, is the fundamental right, especially the nutritional food. In Nepal's health, if you look at, is suffering a lot because undernutrition. And he talked also about the overnutrition in developed countries. I think these are two different problems in two different perspectives of two different countries. But I think the important thing is the right to information. People would not be able to make informed choices unless you take that information, to them, and evidence based. And also he touched upon the food waste and recycling. I think that, and in all of this, whatever we said, I think the role of AI, the smart health we call it, I think we all are in a way directly or indirectly dependent on AI, and we're hoping that AI will help us in achieving our key messages and the goal in the future. So with that note, I think it's been a very powerful 2-hour session by so many eminent experts who've been working on ground zero, from academics to social to philanthropic to industry, and from the food, including from. So I would like to, on behalf of, unless There's no questions. As I was looking my chat box, there's no question on the chat box. On behalf of Smart Health Global, we run over 10 minutes. My apology, because the session was so interesting. I wanted to go it another 20 minutes, but we all have to, go different time zones and have to go for other commitments. So I have to finish it here. It's been an absolute pleasure and honor for me to hold this session on behalf of the Smart Health Global. And on behalf of the Smart Health Global, I'd really like to heartfelt thanks to all our eminent speakers for sharing this on this important National Science Week. And this is not the beginning of the talk. I think this is not the end of the talk. This is the beginning of our relationship. And through this relationship, our partnership will go global and find local solution. With that note, I think once again, thank you very much, every one of you, for contributing to this panel discussion during on National Science Week. Thank you very much.
Thank you so much. Thank you, Dr.
Thank
Thank you, Dr.
very
Raju.
much.
Thank you, everyone.
Thank
Bye.
you, everybody. Thank you.
So if
Thank
we
you.